Good afternoon. My name is Michael Kendi. Welcome to this webinar on the COVID-19 response and digital trust that's co-sponsored by the Center for Trade and Economic Integration and the Global Health Center at the Graduate Institute. As many of you know, a number of countries, including Switzerland, have these contact tracing smartphone apps that alert users if they were in proximity with someone who subsequently tested positive for COVID. Back in April, at the beginning of these lockdowns, a team at Oxford University put out an article called "Digital Contact Tracing Can Slow or Even Stop Coronavirus Transmission and Ease Us Out of Lockdowns," which obviously sounded very, very attractive at the time. And they said that they had a model that if about 60% of the population used such an app, the epidemic could be stopped. They cited some initial surveys that said between 67 and 85% of users in Europe and the US would definitely or probably install such an app. Unfortunately, of course, not everyone installed the app, and of course the epidemic was not stopped. Now, Switzerland was one of the first countries to introduce such an app in June. And in November, the Graduate Institute, along with the EPFL, jointly hosted an event called Data 2025. And several of the EPFL professors who worked on the SwissCovid app presented some numbers showing that at the time, just 22% of Swiss were active users of the app. Unfortunately, I think that's come down since then. And the number one reason for not using it was a concern about privacy and data protection. And there are similar findings in many other countries. On the face of it, this seems like a pretty strong failing of digital trust, to not use an app that could help protect us and restore our lives and get us out of this pandemic, or at least give us the possibility. So as we enter the second year of the pandemic next month, and even with the vaccines in sight and hopefully coming soon, it seems like a pretty good time to reflect and investigate these issues with respect to digital trust and how we can improve it. Some questions are the contact tracing apps worse for privacy than other apps people are using on their smartphones? Would it be a bad trade-off for the potential health benefits if the apps were, in fact, giving up a lot of our privacy? And we'll discuss whether they are. And what can we do about digital trust going forward so that this doesn't happen again? Now, this is a very multidisciplinary issue, and we have just the panel to take it on. Jim Laris, the professor and dean of the School of Computer and Communication Sciences at the EPFL. Meg Davis, senior researcher at the Global Health Center at the Graduate Institute, and Robin Wilton, director of Internet Trust at the Internet Society. And maybe we'll start a little in the past before everything went digital. And Meg, if you could just talk a little bit about the history of contact tracing and the evident and quick need for it that came up with COVID, and then we'll get into the digital side.
Thanks so much, Michael, for organizing this, and I'm really looking forward to what I'm sure will be a very interesting discussion. So to answer your question, contact tracing is really a classic public health intervention that in the past, in its manual form in which individual people conduct the contact tracing, has been used very successfully in epidemic control. And so, for example, we have the case of Ebola. And in contact tracing, normally you have health personnel who've been trained who interview an individual to identify that person's movements during the time when that person was infectious and any other people they may have been exposed to. And then the healthcare worker directly and then privately contacts those individuals at risk to encourage them to come forward and get tested and also to take steps to prevent transmission. And of course, this really rests on the privacy and confidentiality and the relationship of trust between the individual patient and then the healthcare worker. So for COVID, of course, a contact, according to the World Health Organization, is someone who is either within 1 meter of someone with COVID-19 for at least 15 minutes, had direct physical contact with someone with COVID-19 without having personal protective equipment or PPE, or provided direct care for patients without PPE. And the aim is to do this as quickly as possible in order to reduce the risk of transmission. The challenge with COVID, of course, as we now know, is that you often have no symptoms when you're at your most infectious. And so healthcare workers ideally need to move very, very quickly within 3 days or so in order to find those contacts and get them to get tested and then potentially to quarantine. But once you get past a very small number of cases in a given society, it doesn't work as well. What you really need is widespread testing and widespread access to quarantine, it becomes much more difficult to get people within 3 days. You need to actually find and isolate 80% of the contacts, and that's very challenging. Now in Switzerland, as of yesterday, we had 2,400 or so new reported cases a day. So we would need to find, test, and quarantine tens of thousands of people every day in order to really bring this under control. So this requires thousands of public health professionals. And so a lot of people have seen the digital apps as a potential solution. But to really have success with these, we need to be able to answer questions such as, are these apps effective? Are they necessary? Are they proportionate to the risk? And is there transparency in how they're governed? And there I think, is where our debate takes off.
Great, thanks. Yeah, I mean, as you indicated at the end, I mean, the one difference between previous outbreaks is the prevalence of the smartphones that have all these features. They're location aware, Bluetooth. They have much better memories than us, if the app worked. But of course, just in general, we know that there's a lot of privacy issues. So maybe before we move to the specifics of these contact tracing apps and how they were developed, Robin, if you might want to just talk a little bit in general about, some of the privacy issues that arise with these smartphones. What are people giving up in privacy on a day-to-day basis, even without the apps? And then we'll talk, Jim can talk a little bit about how the apps were developed to allay some of these or all of these fears. But Robin, go ahead.
Sure, thanks, Michael. So in general privacy terms, there are several ways in which mobile devices can compromise your privacy. The first and most obvious one, I guess, is simply by recording your location as you move around, because it's a mobile device. And if that information is available to a third party, it takes very few points of location data to create a unique profile that allows you to either specifically identify someone, in other words, say that mobile device is the one belonging to Robin Wilton, or to identify someone in the sense of saying, this is the same person I noticed taking the same journey yesterday. And either of those can be privacy compromising. The other respect, I guess, is also just in terms of device security. And I'm sure everyone's seen at least one instance of an app that they installed to do one thing, which is subsequently found to do something else. So for example, early flashlight apps that would, they would give you a bright light from the camera light of your phone, but they might also siphon off your contact book and send that to someone else. That third party could then reconstruct your social graph, and that gives them, again, both information about you and information about your other contacts. So those are some of the general issues. I think when it comes specifically to tracing apps, there's the added dimension that the data at stake here is to do with healthcare. And therefore, in the EU, for example, it comes into the category of sensitive personal information, which in theory should benefit from particular kinds of protection because of its sensitivity. And I think the other point to think about here with the tracing apps is, as you said, what might motivate people to use the app or not to use it, and to what extent does privacy or concern for privacy play a role in that decision. And here, I think, I don't know if one of my co-panelists is a psychologist, but this seems to be very much like a psychological question. What motivates someone to use an app under those circumstances? And I mean, I am by no means a psychologist, but my personal view is, if someone's got a compelling reason to either install or not install the app, they will do what they feel they want to do, and then they'll find a rationale for it afterwards. Perhaps we can talk later about what some of those rationales would be. And I think we covered some of them in our first event on this topic, but we'll come back to that in a few minutes.
Okay, yeah, no, there was an interesting illustration of the power of these phones. Someone, I guess, working for a mobile operator in the US leaked location data on everyone who had been around the Capitol on January 6th during the riots at the Capitol to the New York Times, and they could instantly trace backwards and forwards where people came from that day, where they were going, if they were in the Capitol. So even if you agree with the motivation of leaking that, it was really a powerful illustration of the kind of data that we're giving up. And that had nothing to do with these apps. But Jim, I mean, having taken into account the worries that were being expressed already as Oxford and others started talking about these apps, can you just talk a little about the process of how the apps were developed and how the privacy issues were taken into account, and the privacy issues that exist with them, if any, today?
Sure, Michael. Thank you for inviting me to be on this fascinating panel. We being the team at EPFL and ETH that designed the original protocol, which was later adopted by Apple and Google in their exposure and notification systems, we're very much aware of this. The earliest app that came out, I believe, was the one in Singapore, which did use location data. So it used the GPS on your phone to record where you were. And right from the beginning, the people who were involved in this discussion, saw that as an unacceptable risk to privacy for the same reasons that Robin indicated. And moreover, it's actually unnecessary. If you listen to what Meg described in terms of contact tracing, none of it was in relation to where you were located. It was who you were in proximity to, whether you were within 1 meter or 2 meters of somebody who was came down with COVID, rather than where you were physically located. The other issue is that we were particularly worried about exposure inside, and GPS is notoriously inaccurate inside of buildings. And so if you based it on location, you wouldn't be giving epidemiologically very valuable information. On the other hand, the Bluetooth features on the phones, the Bluetooth low energy features, were designed to recognize other phones that were in proximity to each other and exchange small amounts of information. And so we, and I think a lot of other people at the same time, realized that this could be used for a form of contact tracing, that the phones could be broadcasting an anonymous beacon, which is basically a random identifier. Other phones could be listening for these random identifiers and recording the proximity and the strength of the signal as a measure of how close the phones were. And that could be used as a way of tracking encounters. There are a lot of technical issues involved in this, both the fact that the Bluetooth measurements are extremely approximate in terms of distance, but on the other hand, the guidance from the WHO is approximate to 1 meter, 2 meters. You know, it's not like if you were sitting 2.1 meters, you're safe. And if it's 1.9 meters, you're inevitably doomed, right? So the approximation in the Bluetooth, I don't think is a first order fact. One of the big concerns, however, is that if your phone is continually broadcasting Bluetooth, it will drain the battery very fast. And so Apple and Google were very concerned with user experience. And so they typically send out beacons every 5 minutes or so, which is a fairly long period of time. And the apps all infer proximity for the duration between the beacons, because that's really all you can do and provide useful battery life. The tricky part with the whole thing, the part that we actually made a contribution on, was how to engineer it so that there was no privacy leakage. And there were two competing proposals. So, you know, you collect these beacons on your phone of people whose phones you were in proximity with. How do you then identify when somebody comes down with COVID, who they were near? There was a proposal for a centralized solution where all the phones uploaded all their beacons and the matching was done at a central server. And then if you determined that you were if the server determined you were in proximity to somebody who was came down with COVID, you would get a notification. There were a couple of issues with this which we didn't like, one of which is the centralization and the fact that the server had complete information about all the phones and who they were in proximity with. And second is that you needed some sort of mechanism for then going back from the server using these supposedly random identifiers back to the phones to notify somebody that they were in proximity with somebody and that they should be tested. We proposed an alternative, which was a decentralized scheme where the identifiers for most people never left their phone. Only people who were diagnosed with COVID, their identifiers were uploaded up to a server, which then broadcast them to everybody else's phone. And the matching was done on your phone. And basically you looked at the set of identifiers that came from the server and you said, was I within a suitable distance for a suitable period of time with somebody? Because if I got an identifier from the server, it was somebody who was diagnosed with COVID. And that's the way the Apple and Google systems work. There's no real issue of privacy here. There have been a number of possible hypothetical attacks suggested by the crypto and the privacy community, but they're fairly small scale attacks. You can do them locally, and they're not really privacy leakages in any strong sense. So the system is extremely private. You know, we had a great deal of hope for this. We thought that it was easy to explain why it was private. We thought it was easy to explain how it operated. And we were totally and completely wrong about that. You know, the world in general did not understand the explanation and did not pay attention to the explanation. I personally had many strange conversations with people trying to explain to them why this app was actually privacy preserving and why it was different from all the other apps in their phone. And, you know, I would say, do you have WhatsApp? And they say, of course I have WhatsApp. Everybody has WhatsApp. And I said, do you have Facebook? And they said, oh, of course I have Facebook, you know. And we produced this poster, which basically listed all of the disclosures that WhatsApp and Facebook did on your phone in terms of the features they use. And it's this very long list of features they use, location and your phone number and your contact book and everything else. And then we listed the ones from our app, which are 4 lines. Very minimal. Basically, it uses the radio, it uses the Bluetooth, and it uses the encrypted storage on the phone. That, again, didn't really explain it to people. And, you know, it was a very interesting, eye-opening experience trying to explain privacy to the general public. It didn't work, I would say, in Switzerland, and I don't think it worked in any country. I certainly don't know anybody else who's been more successful at explaining why this app is fundamentally different than all the other apps. And one of the other issues that Michael raised is actually an interesting one, which is, did we collect enough information? You know, we did to do exactly what the app was supposed to do, which was contact tracing. So what Meg described is exactly what the app does. It's the beginning and the end of it. So there's no additional information that's collected. We can't tell you how many people were, for instance, you know, within 2 meters of an infected person for 10 minutes per day, because that's not what the app is supposed to do. So the epidemiologists were actually quite unhappy with this app. They wanted huge amounts of information so that they could do studies and understand what was going on, which is, I think, quite understandable. But it's this tension that, you know, the information that they wanted was quite opposed to this this privacy minimization. And so, you know, we had the community as a whole being unhappy because they didn't believe that it was privacy preserving. And we had the epidemiologists as a whole saying you were too privacy preserving. And so we really couldn't catch a break on this one at all.
Well, yeah, I can understand the frustration. And at the conference I was talking about the data 2025, it certainly from your colleagues came through. We'll get in, I guess there is some psychology involved, and I'll turn to Robin and Meg for thoughts from their perspectives, but just kind of on a technical basis, Jim, is there evidence even at these low levels of download that these apps are effective?
Yes. So we have done studies in Switzerland in conjunction with other data collections. So there's been a large study in Zurich with the University of Zurich as the lead house doing surveys of residents of Zurich. And one of the things that they ask about is use of COVID tracking apps and notifications for COVID tracking apps. And this is, totally without cite the app, and it's under sort of terms which allow them to collect this information. And so we can actually evaluate within this one community, which is a fairly large community, how much the app is used, how effective the app is in terms of people getting notifications, people who are using the app and then getting a diagnosis of COVID and not getting a notification. So there's a fair amount of data. We've published a study and are sort of doing follow-on studies. More recently, there was actually a very nice study published by the group at Oxford that you're alluding to, Chris Fraser's group, looking at the effectiveness of the UK's COVID-19 app. And their conclusion was actually quite strong that about 600,000 people in the UK were notified by the app, even though the adoption rate there is high 20s, around 30% adoption. And that if you sort of carry it through in terms of the infection rate, there were probably about 6,000 lives that were preserved by people getting the notification, assuming that they all took the notification and went into quarantine at that point and didn't spread COVID further. So there is quite a bit of evidence that it's effective, that it works. Obviously, if we had it up at 60, 70% adoption, it would be even better. But even at low levels, it does have value.
Okay, thank you. So yes, I can see that there must be some frustration having put this much effort into delivering an app that for many is not giving enough data and still and not taking much privacy or any, and still not having it used. Meg, do you want to pick up a little on this question of the evidence?
Yeah, thanks, Michael. And I really want to commend EPFL and Jim and their team for all of the hard work that they put into in thinking about how to address this in a way that is privacy respecting and really holding a strong line across the region on this point. But I think, I have to respectfully disagree about the standards of evidence that are currently available. I think, first of all, why are individuals not downloading it? I think the approach in which we allow each individual to make their own choice about which apps they download just points to a fundamental weakness in governance of big tech. And the sort of lack of regulation of things like Facebook and Twitter, which means we each are sort of forced to engage in regulation for ourselves, which I think is not the most effective system. But frankly, 22% of Swiss people downloading the app is pretty good, considering that there's some anecdotal records of success in different countries. But a systematic review of the available studies in 2020 found no empirical evidence of effectiveness of automated contact tracing. And similarly, The Lancet, which is kind of our flagship publication in global health, has found very weak causal evidence. So, while we do have a lot of mathematical modeling studies, and those are interesting as decision tools and interesting in sort of predicting potential scenarios, they tend to be simplifications of quite complex scenarios. And often, the one from Oxford, with all due respect to Oxford, and I have a lot of friends and family there, is based on estimated data. So, it is very, very challenging, I understand, to get accurate evidence. But I think ultimately we need more solid evidence in order to assess the cost effectiveness of these interventions, and especially for low and middle income countries that are not as well resourced as Switzerland when it comes to responding to COVID.
Thank you. Jim, did you have any thoughts on that? And then we'll turn to Robin. There's a question that...
Sure. I am the first to say that we don't have firm evidence that the tools work in certain circumstances, they don't work in other circumstances. There is aggregate information that we do have. So in Switzerland, when you get a notification, there's a hotline that you call. And we can count the number of calls to that hotline, and we can count the number of people who were given referrals to get COVID tests. We're given the number of people who have gotten medical certificates so that they could go into quarantine without losing their salary. And it's a non-trivial number. It's not anywhere near as large as the number of people who come down with COVID in Switzerland, unfortunately. But we at least have some evidence that there are people that are being notified by these apps, and there are, not only in Switzerland, but in other countries, and hopefully going and taking the notification seriously and going into quarantine. And then it becomes very hard to count the value of it. Do regular contact tracers actually find all of the contacts? Obviously not. There are certain circumstances, for instance, where digital contact tracing is inherently more effective than manual contact tracing. If you're on public transport where you don't know the people around you. With manual contact tracing, you can't tell the contact tracer. I was on the metro the other day and the person sitting next to me was so-and-so if you don't know who they are. But with the digital contact tracing, we can actually notify that person that you were sitting next to them on the metro for a period of time. So there are situations, and we know of actual incidents that fit in those categories. We never from the beginning suggested that this was a replacement for manual contact tracing. I know that the Lancet article, the original Oxford, was very optimistic about how well you could do. We suggested it was an adjunct to it, and it was a particularly valuable one because as COVID, one of the waves went up and the regular contact tracing system got saturated. The digital contact tracing system didn't get saturated. There was one sort of point at which it might have been saturated, which was the call center that received the calls, but that's relatively easy to expand. And it requires sort of fewer resources than expanding the contact tracers themselves, who are much more highly trained and a scarcer resource. So, I think that what you said is literally true, but I think that there is enough evidence to be encouraged with this approach and see it as a useful adjunct in not only high-income countries like Switzerland, but I think also in poorer countries which don't have the trained infrastructure and the resources. But the one other thing I will say, which is perhaps a little bit beyond the scope of this panel, is that the hardest part of this whole thing was not the building the app or the protocol or anything else like this. It was actually the embedding of it in the medical system. So, Switzerland has a sort of expensive first world medical system. It was running on faxes when the COVID epidemic started. They had never heard of servers. They had never heard of all the things that we came in and told them that they needed to establish. They still are having a great deal of difficulty in distributing the codes to people who get diagnosis, the codes that enable them to do an upload to the server. This is a very, very difficult situation, is to change a large distributed system like the medical system and get it to use a new tool effectively, particularly in a short period of time like we have had with COVID. And I think that one of the really big issues in rolling this out in any country is the embedding of new technology in the public health system, in the medical system, in the people that have contact with the COVID patients. It is a real challenge, and I think that a lot of people underestimated it. After we had the experience in Switzerland, I had many conversations with people in the United States, telling them that they should spend a lot more resources and time working on this. And everybody said, oh yeah, it's hard, but they didn't. And I think the net effect was they had the same problems everywhere.
Okay, thank you. Thank you for that answer. Turn to a few questions. Olaf asks, I don't think that this is to imply that the public is at fault. I guess this isn't a question, but I don't think that this is to imply that the public is at fault, just that providing effective privacy guidance to a general audience is hard. Robin, do you have any thoughts on that?
That was actually my answer to Olaf.
Oh, it was. Oh, shoot.
Olaf's
That's
question.
why it wasn't a question.
Well, Olaf's observation was when James said, we went to all this trouble and the public didn't understand the explanation, and Olaf was saying, is that their fault? And I was just saying, no, this isn't really about them being at fault. It's just giving effective privacy guidance to a general audience is hard. And those those who want to read into that further, as I say, I'm not a psychologist, but I did look at that kind of question in the context of users' privacy choices. And one piece of research that I did was to look at a thing called the trans-theoretical model of behavioral change, which is very interesting, and it sets out a number of, I think, about 5 steps that people tend to go through in realizing that there's a problem, finding out what the problem is, investigating it a bit more, making a judgment, and then deciding what they're going to do about the problem. And what strikes me in cases like this is that what you need to do in order to raise public awareness, in other words, to make people aware that there's a problem in the first place, is different from what you need to do in order to satisfy someone's inquiry about what the problem is and how it affects them, which again is different from presenting them with a choice where they can understand, oh, I do this and I increase my risk of suffering this problem. I do that and I decrease my risk of suffering this problem. So through this cycle, the success of the whole enterprise may well depend on more than one intervention at different points in the cycle, and more than one type of intervention, because what you present to someone at the point of choice is not the same as the information that you give them access to find out, oh, I really want to look into this in detail and understand how the contact blinding mechanism works. So you need different styles of intervention, and at any of those stages, things can go wrong. And I think that's a general principle I'm taking from this conversation. There are so many ways in which this can go wrong, even if you get one part of it absolutely right. In other words, in this case, the technical design. But I mean, just to sketch some of them out, I think Michael and Meg between them mentioned a dependence on the track and tracing process being accurate and followed up, a dependence on embedding it successfully into the clinical process, a dependence on motivating users successfully to use the app and to abide by its messages. And then there's one which I don't think we've touched on much yet, but which James hinted at when he said, you know, this is how this has panned out in a pretty advanced economy. And that's the question of financial support. If someone installs the app and then as a result of doing so is told that they can't go to work the next week and they've still got bills coming in, what are they going to do? So in some countries, they're okay because they'll get financial support. In other countries, that very soon stops being an ethical question and starts to become an economic one of how am I going to pay my bills next month? So it's really tough. And there are so many ways in which this can go wrong. I'm sort of jotting down a growing list of what I'm now going to call the COVID calculus about the trade-offs people make and the decisions that they have to juggle. And I've got a couple more for later if we've got time.
Great, thanks. Richard asks for Sarah. It might have come up, Jim, as well with the apps, but what backwards and upward tracing is, how it was used in Asia and why it was not much used in Europe.
Yeah, thanks. And I just really wanted to follow up on Robin's really thoughtful points, because I think we're spending a lot of time, I mean, that's what this panel is about this one intervention. But the intervention by itself is just one piece of a much larger puzzle when we talk about responding to a pandemic like COVID. And it's actually a relatively small piece and not even, I would hesitate to say, even the most important part. Because where it has seemed to work well, it really has been a complement to a much more comprehensive emergency response to the outbreak. And so, for example, to pick Vietnam, which is not an especially privacy respecting context, but nonetheless, we have there a very successful response to COVID despite not being a wealthy country, in part because the health system swung into emergency mode before there was even a single case within the country. And this was in part because of their experience with the SARS epidemic. So they started contact tracing very early, manual contact tracing, and then digital. They were isolating people who were identified as having COVID. There was extensive local testing. So if they found a positive case, they would then test all around that area. They would have lockdowns of localities, which would be difficult to do in Switzerland, but nonetheless, they were taking a number of different measures to try to use the information to make decisions. And above all, everyone who's tested positive is hospitalized at government expense, regardless of their symptoms. And everyone exposed is housed in quarantine facilities, which apparently are not as bad as they could be in some places. So whether or not that whole approach would work in Switzerland, they at least had thought through every single step and were prepared and were responding before they had a single case. And I think in a context where you don't have support for quarantine, where people are sent home and potentially reinfecting their families, where you don't have that kind of access to medical care, then the digital contact tracing by itself is not going to solve anything. And so I think that there's that longer piece that also helps to build the trust that Robin, I believe, is talking about. And above all, I think that relationship of trust between the healthcare worker and the individual who comes in, the empathy, which is very hard to do through an app, but showing to build that trust and that communication, which then engages the individual also as a champion for the health system and has them then going out and sharing information and recruiting other people to get tested. This kind of engagement requires real investment in personnel and much more expensive, but important, I think, to consider as well.
Okay, thank you. There's a question here, and it kind of goes, there's a couple questions that I think go to the decentralized versus centralized approach, Jim. So what do you think of the issue of discrimination, especially when the patient is identified by the tracking applications? And Robin talked about people, of course, having some real economic restrictions on being able to not go to work if they get flagged to have to quarantine. Is this the case in Switzerland? Is this coming up, or would this be another system? Someone mentioned some human rights issues that Amnesty identified in other countries. So can you talk maybe about the experience of other
Switzerland is probably the poster child for having the right set of protections in place. Before the app was deployed in the spring, the Swiss Parliament passed a law governing digital contact tracing. And as part of it, it basically guaranteed a number of rights, one of which is that you couldn't be forced to take a COVID test. The other one is that if you were asked to go into quarantine because of a COVID test or because of a potential exposure to somebody with COVID, you were given a medical certificate, which would allow you to continue to earn your salary just as if you were ill there. And there was quite a bit of protection given to the population in Switzerland. I don't know of other countries that took quite as systematic of an approach. And certainly I know of countries which don't have anywhere near this set of laws. I mean, the US, I think, is probably the poster child for doing it the other way, where sort of, even medical leave is not a guaranteed part of employment in the United States. So yes, I think that these concerns are real concerns. If you're the breadwinner in your family and you're told, go into quarantine for 10 days and don't work and you get no income for 10 days, that's a serious problem for a lot of people. And I fully appreciate that. And I think that it doesn't matter how you get told to get put into quarantine for 10 days, whether it's, through an app or sort of a human. It might be a little bit more empathetic through a human, but the consequences are the same economically in both cases. One of the reasons that we thought that the digital contact tracing would actually gain a little bit more traction is that if you got the notification from the contact tracing and you made the phone call to the center, then you were put into the system in Switzerland where you got the medical certificate at that point. And so it gave you an incentive to actually do the right thing in that case. You were not left out to dry. I will go back to one of the points that Robin raised about this issue of privacy. In many of my discussions with people about the privacy aspects of this app, I had the sense that, and this is not based on sort of empirical data, this is just based on a sense of several discussions, that people were using privacy as an explanation for why they didn't want to use the app. Privacy was sort of in discussion, it was in vogue, it was fine to say, I don't trust the privacy of the app. It probably would have been less acceptable for most people to come out and say, I'm not going to use this app because I don't want to be told that I need to go into quarantine. And the net effect is the same. You're not going to use the app because of a reason that you gave or didn't give. And so I suspect that privacy is of concern to a lot of people, but other people, privacy becomes a surrogate for a bunch of other very interesting factors that drive their decisions. And it's a little hard to separate it, because if you came out and asked somebody, do you really mean privacy here, or do you mean that you just don't want to be told that you were exposed to somebody with COVID? And nobody's going to sort of say the second. So it's going to be very hard to separate it out. I mean, I leave this to the psychologists to do the experiments. But I think it's very important to realize that privacy is a very vague notion. It can cover a lot of things in people's minds, and it can be used as an explanation for other types of behavior. We need to be careful in taking the term literally and interpreting it the way, for instance, people like us in the computer science community interpret it.
So there's a couple of questions that are coming up about the vaccine. First from Tamara, is there a continued need for the COVID app with the upcoming vaccine? Could they work in tandem? Do you foresee future needs for such apps? God forbid. Anyone?
Yeah, well, I guess, I mean, looking at it purely clinically, it probably is important even for people who've been vaccinated, if they are out in general circulation, to have a means of reporting if they are in contact with someone symptomatic, because if a vaccinated person becomes reinfected, that's clinically quite valuable data, I guess. But I mean, I think to pick up again on James's point about the privacy dimension here, and why people might still say, well, yeah, I didn't do it because of privacy concerns, even if that wasn't their genuine motivation, is that privacy and trust are prime examples of this thing called an incomplete predicate. If I say I trust something, it's meaningless unless I say what I trust it for and why. And so we see that all the time in policy announcements. This service is completely secure. This service is completely privacy respecting. But secure against what? Privacy respecting against whom? From whom does it protect my privacy? And so I think one of the trust issues here is that potentially, whether we're talking about identifying someone in order to make sure that they get their vaccine, which is a time when you'd think, oh yeah, I want to be identified because I not only want my vaccine, I want the second shot. I don't want someone else to have it. And the other use case where we're talking about, am I at risk through personal contact of either catching or spreading the virus? And that comes back to Richard Hill's point about the externalities, the greater good rather than my inconvenience. And I think the issue here is that in the public's mind, there is no clear separation between those use cases. It's pretty tough to describe this to a member of the general public in such a way as to convince them that in one instance, in one context, their privacy is being respected, but they are being strongly authenticated so that they can get a vaccine shot. And in this other related context, their privacy has been respected and they are not being identified because this is just about tracing and tracking, and it's all an anonymous or pseudonymous time-bounded token. And that's a really tough distinction to put into the mind of a privacy specialist, let alone the mind of someone who's wondering whether they're going to pay their bills next month if they don't download this app. So that whole issue there boils down to one of governance. If it's in the public's mind that those two use cases are both dealt with by the same set of data, then you have to find some way of persuading them that the context in which those pieces of data are being used is effectively separated. And you can explain the technology to them all you want. It's going to boil down to governance in the end. And do they trust the operation of that governance process? And there, I think, because we've already said how many process-related ways in which this stuff can go wrong, even if you get the technology right, there's a really tough balance of trust to draw there. You've got to convince the public that, okay, the technology works, but also their governance is okay in these 5 other related areas on which it depends. And that's really, really hard.
If I could just come in on this point, I think Robin's making really excellent points. And I think, one of the things we've really seen at a global level, not talking about Switzerland now, but across the region and globally, is this use of COVID-19 as a real excuse for rapid expansion of state surveillance in lots of different domains, and including by states that at one point may claim that they're protecting privacy, and then a moment later you see mission creep and data being used for other purposes. So for example, Singapore's app, which allegedly had a lot of privacy protections, then later on we heard this announcement that in fact some of the data would be shared for the police so they could follow up with individuals on law enforcement matters. So I think we're in this moment of incredible fluidity in which these norms and policies are changing very rapidly. And I think a skeptical public is to be expected in a situation like that. And especially when we're talking about the role of the state and our physical bodies, which are, the most intimate thing we have. In a sense, there's really no more vulnerable kind of intersection.
Thank you. So another question came in, looking forward a little again. What are the learning from digital contact tracing we can take for the vaccine passport? How do you see the passport happening for Swiss citizens, but really just in general? Are there any learnings there?
So it's interesting. It's Switzerland, so if they're going to have a digital passport, it's going to have to be approved by the Swiss Parliament. There's no sort of existing power that I know of that would allow them to sort of move into this entirely new area, the government. And so they're going to have a debate. I think it's going to be a much more interesting, informed debate than the one about the SwissCovid app in May. Just because there's a lot more feelings on all sides of the issue. My feeling is that these passports are likely to be used for a lot of purposes that many people will find to be very objectionable, shall we say. The sort of whole notion is predicated on using them to discriminate among people, between the people who've had the vaccine and the people who haven't had the vaccine, and allowing one privileged group to do things that the other group is not allowed to do. You can make a lot of public health arguments for why this is true, but it's allowing discrimination in ways that we would be very uncomfortable on almost any other basis. You can go out, you can enjoy yourself, you can go into public spaces, you can talk to other people, you can go to movies, you can go to sporting events, you can go to school. And at the point at which everybody could have had the vaccine, when it's sort of widely available and it's a choice to have it or not have it, I think you can make a different argument than now when it's still a very scarce resource and most of us can't get it. That it's sort of extremely discriminatory to have a privileged class that can do all sorts of things that the rest of us are prohibited from doing. So I think it's going to be an interesting debate about these passports.
Yeah, my sense, if I can maybe put on a panelist hat for a second, is that people, if they get a direct benefit from it, like being able to get on an airplane, I think they'll be more willing to download it regardless of the privacy issues. Just like down the lake here in Switzerland, a lot of times you had to sign your name and give your phone number if you wanted to have a coffee when the coffee shops were open, or download an app and scan a QR code to be able to sit down and have a meal. So there was a direct benefit, and you were already just with your phone number, you were giving more information than you're giving.
Right. I should point out that we developed a privacy preserving version of that, which didn't disclose your identity to the restaurant or to put you on any record of having been at the restaurant, but used the same server to notify you in case there was a case of somebody who went to the restaurant and then disclosed to manual contact tracers that they were at the restaurant. So there is ways to do this while preserving privacy. The system that was deployed in Switzerland last fall, which was a commercial system, did not preserve privacy. You had to give them your phone number to register to get the app to run on your phone before you could use it. So there was no pretense of privacy in that.
Right, and I guess would be not many people stood up and walked out of the restaurant.
I would think not, because they were so happy to be able to go to a restaurant.
Exactly. Anyone else have any thoughts on the vaccine passports and the issues that might raise? Meg?
You know I do. Of course I do. Yeah, I mean, I really agree with everything that James has just said. I think I would just want to reiterate the points that Dr. Tedros at WHO has made and others, that the vaccine may or may not reduce transmission. And so having vaccine passports could create a false sense of security, which could actually really undermine progress. I would have a lot of concerns about anything that's linked to biometrics. So I'm glad to hear that there are approaches being developed that might not require facial recognition or fingerprints or anything like that, but that would create very clear concerns. And then in addition to the discrimination issues that James has mentioned, I think, the fact is that we all have a fundamental human right to freedom of movement. And so how can you address this in such a way that you protect data is a large question. But finally, I think again, the bigger issue is that some countries have access to vaccines and some do not. And so we really have to be working towards promoting the vaccine as a global public good and really trying to increase access so that we don't wind up with these two tiers in society of people in the high income countries who can travel around and people in low income countries who are essentially prisoners.
Yeah, Robin?
Yeah, I think the danger of perverse incentives is really strong here. If I need an immunity certificate in order to go to work, I will get an immunity certificate somehow. And if that means catching the disease so that I can claim that I'm immune to it afterwards, then I'll go and catch the disease. And that's really weird. Or provide evidence that I've got the disease. How many ways could people game the system here? And how many of those are really nasty to contemplate? So there's that, and then as Meg says, the WHO guidance says, well, actually, this is not a binary thing, and the way that I put it in that blog post I linked to is that the immunity certificate is not proof; it's evidence, and evidence can be unreliable, and you still have to make a decision based on that evidence. If you're letting someone into your country, or if you're letting them onto public transport, or if you're letting them work. So yeah, in addition to all of the comments about discrimination, there's then this point that actually you have to base that on evidence, not proof, and the evidence may be unreliable.
Okay, thanks. We're coming in on the top of the hour, so maybe just kind of thinking back on this, I'm just wondering in general what we can do to increase digital trust. I mean, that was kind of the starting point, that this was an indication, in this case, based on maybe a misunderstanding or, a misunderstanding or lack of understanding of what the app was doing, but what it could do. But there was just a general lack of trust that was behind a lot of people not downloading. So I'm just wondering if each of you could reflect, if from your positions, what can be done, what could have been done differently, what could be done in the future. Jim, maybe starting with you, would you have done anything different knowing what you know now in terms of designing the app, rolling it out?
Yeah, actually, paradoxically, I think the rollout, at least in Switzerland, and I think in many other countries, was done the wrong way. It was done by government officials telling people to use it and getting written up in the newspaper as something you should use. They didn't approach it the way a commercial company would, which is to find figures of trust, public figures, sports figures, music figures, people that are known and respected, and having them come out in public. In Switzerland, there are sort of obvious candidates, which we joked about all spring. is Roger Federer going to come out and say, hey, use SwissCovid, right? You know, he would have had sort of far more credibility than any government spokesman. He would have been known by the population. We probably would have gotten a much, much higher adoption much faster. Because I think that, you know, people who have independent credibility, who are seen as having integrity, who are seen as being people worth listening to, can sort of surmount a lot of these barriers. You know, the issue of trust of the app, the issue of not understanding the app, the issue of not really understanding what privacy is, not being able to distinguish it from the other apps on your phone. If someone you respect, someone who's sort of publicly well-known comes out and says, do this for the good of the country because I'm doing it too, I think that would have helped a tremendous amount, strangely enough. You know, it's sort of an old-fashioned way of looking at it, but I think it's really true, is that there are certain things that you can't explain rationally, but you can sell to people using sort of innate emotions that you want to sort of be like somebody who you respect.
Okay, so a way of generally building trust in it, but not necessarily educating, which may be too far a bridge across for this for the app. So Meg, over to you. And one thing I noticed, my wife had totally, you know, an ankle operation, had to test and everything, and at no point anywhere in the healthcare system did anyone, when she tested, when she went to the hospital, did anyone tell her to download this app. So I'm just wondering what your view is on the healthcare system. Was this just overtaxing it, or you know, is there anything that could have been done differently in that perspective?
Well, I think you make James very sad when you say that, Michael, but
I am not surprised.
You're not surprised. I think overall, you know, the health system at the moment, we tend to get very excited about one digital intervention or another digital intervention. And some of them are very exciting, and they do offer all kinds of new potentials for us to leap forward, and especially in countries with weak health systems. And I come from one, I'm from the US. So, you know, how do we leap forward and really get more people access to the health services that they need, and also prepare not just to get ourselves out of COVID, but prepare for the next pandemic. But it's really not just about one intervention or another intervention. I think it's about building a strong health system, building strong social protection systems, you know, having strong rule of law, strong legal protections, so that people, individuals, aren't forced to make these decisions one by one, but actually, you know, begin to develop the trust that they can download something and feel that it will work for their good.
Okay, thanks. And Robin, you're the Director of Internet Trust at the Internet Society. So stepping back maybe beyond just the issues raised by the app, what are your views on how to generally help to build up digital trust? Not necessarily just in these apps, but so that maybe people were better prepared to be able to evaluate the pros and cons based on the real privacy issues involved.
Yeah, thanks for leaving me 90 seconds to do that one. I think actually what I'll come back to is that, and this addresses Richard Hill's point about the externalities to some extent as well. To come back to the interventions that make people more inclined to make the right choice at the right point, whether that's the decision to download the app or not, or the decision to use it or not, abide by its recommendations and so on. And that is, and this is in line with the model I mentioned earlier, the trans-theoretical model of behavioral change, that what you need to do ultimately in order to make that behavioral change sustainable is change the value that someone places on one option rather than the other. And this has worked in things like nutritional health, it's worked in things like cholesterol management. If you do it right, you change the value someone places on that decision, so that they're not just saying, well, I could go to the pub if I download this app and the beer is here, it's present right now. Whereas this other thing that I have in my other hand is kind of nebulous and I don't see the virus and I might not catch it anyway. And I went to the pub yesterday and I haven't got the virus, but I did have the beer. And so you've got to rebalance that value and say, well, actually, you know what? I might value 5 extra years of life or not having a pulmonary complaint for the rest of my days over having a beer tomorrow. And if you can change that value calculus, then you start to influence behavioral change.
Okay. Thank you. We've got 1 minute, so with good Swiss timing. Sorry, there are some more questions in the Q&A, but we want to keep to the time. I just wondered if we can, if everyone could just kind of give, 288 character tweet on their final thoughts on this. Jim, just a few final reflections.
So, if this was the last epidemic, I would say, we tried and, it didn't work out as well as we would have hoped. Technically it was fairly easy to build. We can correct many of the problems in the coming years. I suspect this is not the last epidemic that we face. And I think it's really important for the World Health Organization and the health community to figure out how to use apps like this to supplement manual contact tracing and find ways of controlling the future epidemics using digital technology, because everybody does have a smartphone and we should figure out how to use it effectively.
Great, thanks. Meg?
I'm very bad at tweeting. I have all my tweets are like a paragraph long. I would just say, look, whatever tools we develop, we have to hold them to a high standard of evidence. And we need strong regulation to protect our privacy. And we need to invest in health systems to protect the right to health. So I'll stop there.
All right, thanks. And Robin?
Okay, well, technology is never enough to deliver trust. You can minimize the extent to which it depends on governance and on procedural measures, but you can never eliminate it.
Thank you. And thank you everyone for joining us. Thank you in the audience. I'm sorry we couldn't get to all the questions. And I'm sorry we can't show our appreciation through applause on a Zoom call. But thank you very much for your time and for your reflections on this. Thank you.
Thanks very much.